Helen's assured me she can see and hear us both.
Okay, well, that's good. Do you want
Yeah.
to start with an introduction to what we're doing today whilst Helen tries to on?
Yeah, so I will now start. So welcome everyone. Thank you for attending today's open day for our renal medicine and urology programs. To start off, I would like to give a quick introduction to our renal neurology courses. We are currently struggling to get some people onto this event and some of our tutors as well for these courses. So I do apologise that you are unable to meet some of the faculty today, but nonetheless, I am more than happy to give an overview of this course through a quick presentation. If we do get Helen Davis, Head of Programme Development and Innovation, here today, she'll be more than happy to go into just a little bit more detail about the brand new urology course afterwards. But we will go through an admissions process with Kirsty. We will show you a brief demonstration of our online learning platform, and we will close to a Q&A where you'll get the opportunity to ask someone from Student Services and Admissions any questions that you may have. If you have a question and you would like to put it in the chat box, that's brilliant. We'll be able to answer it there. But if you want to message us with a question and you don't want to put it in the chat box, you can always do it as a direct message, which is a feature on the left-hand side. We will be able to email you afterwards if we don't get to answer all questions today. So first, I'd like to give an overview of our renal course. We have got a small presentation prepared, so let me just share my screen with you all. Can you see that okay, Kirsty? Brilliant. Okay, so I'll just take it from the beginning. So this postgraduate diploma and MSc in renal medicine is designed to improve your management of acute kidney injury and chronic kidney disease, and will give you the confidence and skills you need to improve patient care. Our diploma in renal medicine is conducted entirely online through self-directed distance learning, which means you can complete your studies around your family, work, and lifestyle commitments. The renal diploma course is scenario-based with clinical focus and is designed on extensive research with primary care practitioners. It's highly relevant and includes the latest developments in renal medicine for frontline healthcare professionals. For the urology course, we now have a urology page live on our site, but it is still subject to validation. Students can still apply for this course, and admissions will just let you know as soon as the program has been validated. I just wanted to let you know that there is a lot of interest surrounding this course, and due to high demand, we have opened applications, but we do advise you to create and submit an application as soon as possible to avoid missing your spot on this course if you are interested. But just to give a summary, this program will complement a number of our existing and future programs where a desire to increase practical awareness of urological conditions and care pathways would be satisfied with this highly specialised program. This PG DIP and MSc in Urology is designed to provide healthcare professionals who encounter patients presenting with urological conditions and wish to improve their knowledge, their skills and experience in this area. And on successful completion of this course, which is highly sought after and recognised level of education, successful completion of this course will add value to your CV and will enable graduates to rise to the challenges of delivering high quality care to their patients within a complex primary and secondary care environment. So who is it for? So with the renal medicine program, it is designed for healthcare professionals either in the UK or overseas, in a role in general practice or a secondary care healthcare professional managing patients with systemic diseases that may affect the kidneys. And then for urology, this program is aimed at specialist nurses, GPs and GP registrars, specialist registrars, and pharmacists. Most of our courses are accredited by the RCGP and European Union of Medical Specialists. When you complete your studies with us, you will gain a recognised medical qualification, in just 1 year. So that's twice as quick than most postgraduate courses. And our programs are validated by either the University of South Wales, Buckingham University, which hold a GMC accreditation, and then Gibraltar University. So thank you for listening to that quick presentation. I'm just going to try and exit out of this if it lets me. Okay, stop sharing. Is it stop sharing now, Kirsty, or is it still showing?
Yeah, you're all fine. Stop.
Brilliant. Okay, so next up, we'll talk to you, Kirsty. We'll go through the admissions process. So thank you for being here today. My first question to you is, how does the application process work? So can you just talk us through how to apply, what happens when students get accepted, just everything up until they get handed over to student support?
Yeah, of course. So once you've decided what course you want to apply for, if you pop onto the product page of that course on our website, you can just put the name of the course in the search box and should be able to find it quite easily, and click on the pink Apply Now button. Then it will take you through to our application process. An application form takes probably about half an hour to complete, but I would advise that before you kind of get started, make sure you've got all the documentation that you will need to upload. So things like your certificates for your qualifications, proof of English, names and things of your references before you start the application, and that'll make the whole process a whole lot quicker. Once you've submitted your application, the admissions team will review that, and they'll drop you an email if there's any further information that they require in order to process your application. And then if you're lucky enough, then you'll be accepted onto the course and you'll receive your acceptance letter via email. But it's worth noting that your place on the course is not secured until you've actually paid the initial deposit payment. And you can do that online via the application dashboard, or you can give us a call and do it over the phone, whatever works best for you. There's several different ways of paying that deposit, but once you've been accepted, your place on the course is not confirmed until that deposit payment has been made. And then once the deposit payment's been made, you will then start receiving some information from our student support team before starting the Study Skills Week and your course.
Brilliant. Okay. So let's talk about the requirements then. So general qualifications and experience. Yeah. Can you just go into detail about how some of those courses can differ, and it's not like one size fits all?
Yeah.
Lines.
It does really depend on the course, but as a general rule, in order to be eligible for one of our programs, you'll need to hold an undergraduate degree in a health-related science or a medical degree, and be working or have some experience in the field in which you wish to study. If you don't hold an undergraduate degree, then something, for example, like a diploma in nursing, but you have the relevant experience, then we would still encourage you to apply. And all we need you to do is a quick assignment, which will be very similar to the work that you'd expect during the course, just to make sure that you're happy with doing that level of work, and we're happy that you'll be able to cope with that level of work. But as I say, all the courses are different. So some courses you don't necessarily need a health-related degree. So something like health economics, you wouldn't need that. But for urology and for renal, you will need a medical degree or an undergraduate degree in a health-related science, or the equivalent experience if you don't have those.
That's excellent. So what kind of people might apply for these programs? Obviously, we have just gone through that it would be like GP registrars, specialist nurses, but is there anyone that I might have missed?
Yeah, exactly all of those. So I think especially with our renal program, it's it's suitable for primary care or secondary care, doctors, nurses, perhaps pharmacists might look into these programs, but really anyone that's a registered healthcare professional working within or dealing with patients in that area would be eligible. But we would need you to have that kind of knowledge because of the clinical content of the courses. So yeah, healthcare professionals, so that can be doctors, nurses, pharmacists, primary or secondary care, working within that area.
Perfect. I think that was very clear. Great, thank you for that. And what about English? So can you explain the IELTS? If someone didn't have it, can they take something else instead?
Yep. So all students must provide proof of English if English is not their first language, or if they haven't studied their undergraduate degree in English. Sorry, I lost my words there. If you don't hold IELTS, we can accept some alternatives depending on the course which you're studying in the university who's validating the course. So for our University of South Wales courses, we can accept Duolingo, but this does vary course to course. So if you've got any questions or you're not sure, just contact us in admissions and we can give you some further information on the best pathway for you.
Brilliant. Okay. And then what about references? So how long does it have to be? How does it really work? Does someone who's created the application chase it up, or is that admissions?
No. So we'll ask you for the name of 2 referees. They can be a work colleague, an employer, a former tutor. For the majority of the courses, we actually don't need 2. We just require 1 reference, but we ask for 2 in order to make sure your application is not delayed whilst we wait on them. The admissions team will chase references for you. So once you've given us those details, we'll get in touch with the referee and send them what our requirements are and chase for that. But we do ask for 2 so that if one is a bit slow in coming back to us, then we've got a backup.
Yeah, that makes sense. So with personal statements, how long should that be? What do they need to talk about specifically?
So there's not really a right or wrong with personal statements. It's personal. In terms of length, you're looking to write around 500 words up to a maximum of 3,000 words. And really what we want to know is an insight into what you're doing currently work-wise, and then what your motivations are for doing the programme. So what made you apply for the course, what you're hoping to get out of it. Are you looking to start specialist training in the area? Are you looking to apply for a promotion, or just expand on your knowledge and improve clinical outcomes for your patients? So really we want to know about you, what you've been doing and why you want to do the course and what you think you're going to get out of it.
Brilliant. If someone wasn't sure about applying, what advice would you give? Do you think that they should still apply?
Yeah, we understand that it's a big commitment, time-wise and also financially. But if you've got questions and you're really not sure, then you can schedule a call with us in admissions, and we're happy to answer any concerns you might have, and help you decide whether the course is right for you at the moment and then the right path for you to take.
Okay, brilliant. And then once you've created your application, you've made the decision, you've submitted it, what happens after the application is completed?
Yep, so you'll press the submit button on your application, and we'll get notified of that. And then the admissions team will review the application. And as I said earlier, as long as we have everything that we need in terms of all the documentation, evidence, certification, etc., then we'll be able to fully assess your application, and you'll receive either an acceptance or a rejection letter via email. But just know that hitting submit does not mean that your application's finished. We may well have to chase you for some more information.
Yeah, that makes sense. So what happens after they've been accepted then?
So once someone's been accepted onto the course, you will receive an email to let you know. And at that point, you have to, as I said earlier, secure your place by paying your deposit on the application deadline. The information on how to do that will be with the acceptance letter. But many of our courses do fill up well before the application deadline. So generally what we'd say is once you've been accepted, if you're sure that you definitely want to go ahead and start the course in the next cohort, you pay that deposit as soon as you can, because we do often get some quite disappointed students who'd wanted to join and have to defer their entry because there aren't actually enough places left on the course for that time because they left it to the last minute.
Yeah, that is true. But what happens if they've been rejected? Could they apply again with do they just need more experience? Is that why they've been rejected?
It depends on why someone might be rejected. You'll receive a detailed email explaining on why we've been unable to offer you a place on the course. So it could be due to the lack of relevant degree. It could be a lack of clinical experience. If it's a relevant degree, then unfortunately that's quite a difficult one to get around. However, if without going and doing that undergraduate degree, but if it's clinical experience, then absolutely we would hope that someone would go away, get that extra experience, and then reapply at a later date. So that's usually the process.
Okay, great. Thank you, Kirsty. It was really informative, very helpful. It does appear that we have Helen with us now, which is excellent. Helen, I did just give a quick presentation on our urology program, but it was very brief. If you wouldn't mind just going into a little bit more detail about our brand new urology course, that would be excellent. Just discussing the module content, that would be really useful for everyone who's joined us today.
Absolutely. Thank you, Jess. I did hear you. I just couldn't join, and I didn't want to disrupt anything then as Kirsty was speaking. So thank you. Thanks for your patience, and good to join in. I've just been reading a few of the comments that are coming through as well. So I hope to address some more of those if there's any specific questions that I can answer. But as Jess gave quite a really clear overview of the urology program, it's brand new. We're developing it this year, and it's born on the success of the Renal program, which we've been running for some time, and the desire from our audience of students around the world to look a bit more deeply into urology. And urology applies to male and female patients and in pediatrics. And we are devising a broad program for coverage of all of those type of urological problems. So not to get too much into the clinical detail of it, but we have categorized the modules. There's 6 modules to be worked through as part of this program. They're designed for a multidisciplinary team, and urology as a topic as a highly surgical interest, and of course many of the urological procedures are surgical, but this program is designed to address the medical care of patients up to the point of surgery and aftercare as well for patients. So it's diagnosis of these conditions and an understanding, if you're a nurse in a particular clinic or if you're a GP with a special interest, then this program will be excellent for you to have a much deeper understanding of the medical presentation of some of these common diseases for men and for women, and then how that would be referred into secondary care. If surgery is an outcome for that, it would describe that route for those patients, and then when the patients receive the treatment, how the aftercare happens, and then ongoing management of those conditions. So it is quite detailed, but for a good reason, and it does go into quite a few of the areas then in some detail in each of those modules. So anybody, as I say, with a special interest or a number of patients who are presenting with these types of problems, it's an ability to get into that level of detail, or indeed to join in any research on any of these conditions, because this affects over 10% of healthcare presentations for patients in Europe and the UK. 10% of those are urological problems. And so this is an opportunity for us to really expand the thinking and expand the research on this particular area as well. There's not too many other programs available strictly on urology, and we want to bring some more discussion to this audience and to this particular specialty group as well. So this is an opportunity for us to really match some of those topics into what else is available out there, and to define this program to be a really important addition to the conversation and to the research that's going on in this area.
Brilliant.
Would you like me to go through each of the module headings? Would that be useful? Or because I know we've got some of the detail on our webpage, but it's brand new and we're just bringing this content together and ready for September. So, but I can talk to each of the module headings if that's useful.
Yeah, no, I think that'd be really useful, Helen.
Great. Okay. So, so as I say, 6 modules that are topic related and will be separated out into conditions, so into presentations of this particular range of diseases. So module 1 addresses some of the more common presentations and includes LUTS or lower urinary tract symptoms. Module 2 moves on to prostate and bladder cancers, the cancers, the early diagnosis of these, and the progression of these particular cancers as well for various patient scenarios. Module 3 will go into urinary tract infections, and then module 4 is more focused on the male presentation, so renal, penile and testicular cancers are for module 4. Module 5 is renal tract stones and obstruction. So again, quite a broad presentation there and a wide range of patients that are affected by these types of conditions. And then module 6 is a focus again on male health and andrology, erectile dysfunction and Peyronie's disease as well. So quite a broad range of topics. The balance between male and female presentations is important for us to present here, depending on the type of career that you're in and the role that you are working in a particular team. So a good coverage of women's health problems and men's health problems covered in the programme.
Brilliant. Thank you, Helen, for going through that. It sounds like a very exciting course. So yeah, thank you for going into some detail about that. I can see all the questions that are coming in, and we will definitely be able to go through all the questions at the very end. But before we do, I do want to show a video of our online learning platform. I'd just like to ask all hosts, I know Kirsty's just muted herself, but Helen, if you could mute yourself, that would be brilliant, because sometimes when I play the video, it creates this echo. So we'll try and avoid that noise again. Let me just try and get the video up. And if someone could just unmute and let me know if the video is sharing and then pop themselves back on mute, that would be brilliant. So let me just share the video. Okay. Is it the video sharing, or is it not? Did someone say no?
We can see it, but it's not playing yet.
Okay, that's fine. Ooh. Is it on?
Learning platform Moodle, where all of your studies as a student at Learner will...
I'm just going to play it from the beginning because the sound wasn't on then.
Welcome to our open day at Learner. My name is Benjamin from Student Services. In this short video, I'll be showing you a brief introduction to the learning platform Moodle, where all of your studies as a student at Learner will take place. When you start the application process with us at Learner, you will be provided with your login details to access Moodle, the learning platform. The login process is simple and straightforward. Press the blue Learner login button here, and then simply enter your username and your password into the text box and click the login button. Once you've logged in, it will take you to your dashboard. This is the easy to navigate homepage where you can access your modules and all of the supporting resources needed to aid you in your studies with us at Learner. For today's introduction, you can see Cosmetic Medicine Module 4. To access the module, press the Explore button seen here. Please be assured that the Moodle platform is interchangeable with all of the programs that we offer here at Learner. So please do not worry if you are not studying this particular program, yours will look the same. As you can see, each week has its own individual section. For the topic of today's introduction, I'll be showing you week 1 and how to access the academic forum. You can access the academic forum, which is the weekly equivalent of an in-person seminar in forum form, by clicking here. As you can see, There is an example post of a welcome post here, as well as an example on how your case scenario post from your tutor would look on the platform. Once the tutor has posted the case scenario, you are then able to respond with your research and interesting discussion points via this direct thread. Each module will be in an individual section, such as the Study Skills Orientation module, where you will access a range of introductory guides and videos that will discuss the platform in greater detail. The Instructions and Resources section, where you can access the marking criteria and easy to follow guides for each component of your module. And the Learner Library, where you can access your reading resources, academic search engine, and partner university information. This is the Learner Library, where you can access a wide range of resources that will aid you throughout your studies with us at Learner, such as your reading resources, a selection of academic search engines, such as Google Scholar, and further useful resources such as Mendeley, an external, free-to-use reference managing system. As you can see via the drop-downs, there are guides to literature searching, a guide to referencing, and a guide to poor academic practice and plagiarism. Furthermore, if you scroll down slightly, there are a range of open access ebooks that you can use to aid you with your studies. Further down the page of the Learner Library, within the Bibliographic Resources section, you are able to find academic search engines such as Academic, BMC, and Cochrane Library, and many more, which are there to be utilised and assist in finding the most suitable sources for your research. If you scroll further down the page, you can find the Useful Resources section. We recommend that you take full advantage of these, such as Mendeley and Grammarly, which become very useful in your studies. At the bottom of the page, you can find your reading resources. When you begin your program, you'll have access to these resources for your respective program and find all the relevant materials and reading resources for that particular week and for that particular module. Though our platform is designed to be extremely easy to navigate, onboarding onto a new online platform can be overwhelming. In each section of the platform, you can find direct links to contact the Student Services team, who can answer any queries or questions that you have throughout the entirety of your studies with us at Learner. We hope you have found this short introduction helpful to your application, and we hope to be onboarding you as a student with us at Learner very soon.
Okay, stop sharing. Okay, brilliant. So that was Ben from Student Services. We do have Student Services in the chat ready to answer any questions that you may have. So I hope that you were all able to see the video okay. If not, that's fine. We'll be able to email you after this event and send you the video with some extra information as well. We do hope you enjoyed this open day. We are now at the end of this event, but before we close, we'll go to a Q&A and we'll answer some questions that have come through in the chat box. So I'm just going to go through them quickly.
As we go through, I think that it's worth noting that before you actually start your course, you will go through a study skills week, and that study skills week will really teach you how to use the learning platform, the academic forum, the library, the best ways to referencing, reflective practice. We really go through everything that you'll need to know before starting the course. So I know it can seem a little bit overwhelming at first because it's quite different to a traditional postgrad course, but that's what our student support team are here for, is to kind of guide you along the way, help you with any issues whatsoever that you're having, and really show you what's expected of you in order to succeed in the course. So I just wanted to point that out.
Thank you, Kirsty, for adding to that after the video. I'm just going through some of the questions that have come through, and I can see there's one from Emma from Wales. She has asked, with the renal medicine course, would I need to take time off work to complete it? So no, we are 100% flexible. All learning can be done online, log on anytime, anywhere. We do understand the healthcare professionals are very busy with no set time, so we have no fixed timetable. So it's very convenient for students, allowing you to complete your studies around your other commitments. So yeah, you wouldn't need to take time off. I'm just going through some more questions. I can see that Linda from England said, does any aspect of the assessment rely on you being able to provide your own case studies? So, for example, if you don't work in primary care, would you need to work out how to get access to that kind of patient? So I can see someone's replied saying, hi Linda, from our experience in student services, students have been able to use hypothetical scenarios in situations like this. So I hope this helps, but please do let me know if you have any further queries about this. We will be able to email you after with further information should you require.
Can I add to that one as well? Jess, just a second. Can you hear me okay?
Yeah, can you hear you fine?
Oh, yeah, Linda, I was just going to say, if Linda's still there, that the great advantage of the academic forum, which is the main activity platform for students in their learning group with their tutors, is to share experience and share case studies, and then to go off and add to the reading and add to the discussion. So if you don't come with a case study of your own, your group will certainly present one together, and then you can comment and you can research your answer and your contribution to the academic forum on that case that's been brought by somebody else, by one of the other students. And that gives a depth then to the learning as well, because all students will come with an experience level of memory of case problems or realistic scenarios that they may even currently be experiencing or have heard from another colleague maybe that's worked through. So you can discuss those as a group. So that's the great advantage of the academic forum, of being able to share that type of detail and then add to it for everybody.
Yeah, totally agree, Helen. Thank you for that. Emma from Wales has asked, if I am working during the day, can I catch up on lessons in the evening? Benjamin has replied and said, following on from this, there are no lectures as such for students to attend, which makes our course suitable for students seeking flexible learning. So our course components, such as the academic forum, are in place to support this. Rachel from England has asked, what experience do I need to apply for the renal course? Unfortunately, our renal tutor is not here today. He was unable to get onto this event, but we will be able to email you afterwards and to go into a lot more detail with that. But
yeah, just to add to that, I did reply to Rachel in the chat, but yeah, you would need to have some clinical exposure to patients with experiencing renal issues or with conditions that affect their renal function. So some kind of working experience of that, but you certainly don't need to be a specialist in that area. It would just be something that you are encountering in your role. So yeah, it's we can give you some more detail if you've got more questions on that, Rachel. But we certainly, if you've got some kind of clinical experience in that area, then that's what's required, along with the undergraduate study. I think Jessica has somehow managed to drop off, so I'll pick up because I'm not sure where she's gone. Maybe her internet has dropped out. Where did we get? So Algina's asked how the courses are assessed. Helen, do you think you can go through that quickly? Oh, you're on mute, Helen.
Yeah, sorry, I was just messaging Jess then. Just me. Yes, okay. So this is specifically for the renal program. This does differ slightly program by program. So we're covering a few different programs today, but the assessment is basically in 4 particular areas. There's the majority of the marks for the program are assessed on the academic forum. So around 40% of the marks will be from your activity within the forum. And that's the area where you'll discuss realistic case problems. You will address the activities that the tutor sets for the group each week, and then your interaction with your fellow students and the detail that you bring and your research to that all comes together to make the majority of the marks. We also ask all students to actively reflect on their learning, reflect on how those experiences have been applied back into your place of work, or indeed, if that's helping towards your career progression, how you might bring these new skills to that future career path. So a reflective journal constitutes 10% of the overall marks, again, broadly, depending on each programme. We will set a module activity. So this could be a group activity where the student group, so our groups are usually between 10 and 15 students per tutor. And within that group, you may have an activity where you all join together, again, on a very realistic work-based scenario, something that you would definitely come across within the current industry, and allow you to bring that together. So it feels very realistic. And the reasoning for that is then that even though it feels like an academic activity, and you may be working together as a group or as an individual, these are skills that then you can apply directly back into your role, your current role, or indeed as you progress in your career. This might be a slide presentation or another form of presentation to the tutor at the end of that activity period. If it's an individual activity, we try to make those very useful and very skills-based. So there would be a poster presentation. And so you practice your skills. You may not have had an opportunity to present at a conference, but there could be a poster presentation or a slide presentation included, or a paper to be written, maybe 3,000-word paper on a particular topic area. So the activities are designed to really align with the types of activities that you would like to achieve in your academic activities within your role and your career progression. And then the last part for all of our medical programs is a case-based exam, and that comes at the end of each module, and that's a set of MCQ questions that are based on the learning points that we would have tested you on, or that we would have applied your learning to within that particular module, and all of those scores go towards your end result. So that makes up each module, and again, there's 6 modules on each topic area, and then a final project at the end if you go on and do the master's level.
Well, thank you, Helen, for answering that question. I'm really not sure what's happened there, but I just disappeared. My Wi-Fi is fine, but I think Unibuddy just likes playing tricks. So back, I'm assuming you answered Linda's question, or have you not answered it yet? So she was asking, what does module activity mean? Is that what you were going through?
Oh gosh, brilliant. Yes, actually, yeah, it does. And hopefully it answers that question too. But those are the types of module activities that we were doing. Now, it was the earlier question just above where we were talking about the types of assessment for each module. Right. But yes, Linda, the module activities, again, a group activity could be offered, or individual activities. And that's really down to the tutor for each of the groups. And again, they're based on very common activities to enhance your academic practice and your academic output, as well as your applicable knowledge back into the role.
Excellent. Thanks, Helen. Someone has asked, do you have scholarships for the renal programme? Unfortunately, many scholarships do not cover this online programme. We have replied to this.
I can pick that one up, Jess, just to share with everyone else if they've missed it in the group. So we get a lot of questions about scholarships and bursaries, and our courses are extremely affordable when compared to many of the on-campus courses of a similar content, mainly because we don't have the overheads that a big university would have in terms of, funding a campus. So we try and keep our costs as low as possible with no international surcharge. We do offer an early bird discount, but that's actually expired now. And for those who are from Hinari Group A countries, there is a small scholarship fund that we have available. That scholarship fund would pay for 50% of your fees, so it would reduce the cost of the programme by half. So it's not a full scholarship. And it's available for those who are eligible on a first-come, first-served basis. So if you were interested in accessing that fund, my advice would be get your application done and submitted as soon as possible, and let the admissions team know that you would be interested in the scholarship fund from those from Hinari Group A. I think I can see it from Kazakhstan. I'm not sure off the top of my head whether that country is in Hinari Group A or not, but we will assess that along with your application. But that, as I say, that fund isn't large. It only covers a small number of students, and it also only applies to a 2-year MSc course as well, not for the 1-year PG dip.
Thanks, Kirsty, for expanding on that question. I can see Linda from England has asked, does the Learner Library have the same resources as any academic institution? So we did reply to this and we said, yes, we have a large selection of databases for students to access, and you'll also have your partner universities library resources for additional reading materials and support. Algina from United Kingdom has asked, how do students communicate with tutors on a one-to-one basis, and how much one-to-one time can tutors dedicate to each student? We haven't been able to answer that in the chat. But
I have actually, Jess. I can see that someone has.
Okay.
So you are able to directly message tutors via the Moodle learning platform, and that's your prerogative to use that feature. Tutors provide plenty of support through their responses to your posts in the academic forum, which are public, and they can also provide responses in the reflective journal section. Our courses have quite small classes, so usually around 10 people per class. So it's quite a small group, and the support's really there for you, not only with the tutor, but also, as Helen mentioned earlier, with that kind of multidisciplinary approach. So you'll have people in your group who are doctors, nurses, allied health professionals, pharmacists, and you can really get that multidisciplinary perspective on the scenario, and also international perspective on the scenario as well. So what you'll find is, yes, you will be learning from the scenarios and from your tutors, but you'll also be learning a lot from your fellow students in your class.
Perfect. Someone has just asked, what are the payment options? I can see that we've replied to this, but I'll just say what the answer was. So you can pay in interest-free instalments on a module by module basis, or we work with Lemwise, who can spread the cost over a longer period of time for those based in the UK. The details of these options are available on the website. If you are struggling to find that information, it's no problem. We will be able to email you all the information. I'm just going to have another scroll through to see what other questions have come through. Algina from the United Kingdom, she has asked, how will the MSc in Urology help me progress in my career? Helen, would you be able to expand on that a little bit?
Yeah, certainly. As the response said, it certainly helps with career progression, as I mentioned in the start as well. Depending on where you are in your career path and how you'd like to progress, the urology topic is broad, covers a great number of patient presentations in primary care and in secondary care, and there's a drive for more specific clinics to be set up in private healthcare and in the NHS within the UK. So multiple career opportunities directly in patient-facing roles. Clinic management and clinic setup overseas is a very important aspect for some of our students as well. And because of the activities that we've just described, we very much focus on leadership and management of multidisciplinary teams. And coming into this as a postgraduate student, we'd expect you to be at the level where your leadership skills are the parts that you would really like to progress and then go on to manage the programme. Indeed, we have multiple programmes that can help in all aspects of that management of a clinic or setup of a clinic. But it is something that we focus on into the programmes as well. So just a few examples, and then of course going into research, and you may want to progress to masters, you may want to progress to a PhD or a higher level of research into that particular topic area. Again, such a broad topic area, and it's at the forefront as well. I don't know of the group that we have here today, but urology was the pioneer in quite a few of the procedures that we know today. So keyhole surgery and some of the non-invasive procedures were all devised originally in urology. So again, a really good specialty for further research opportunities as well.
That's really interesting. Linda from England has asked, do you have any examples of what kind of things people write about for their professional projects? And I can see we have responded to this. We have said, check out this area of our website, which has a bank of published papers which our students have written for their professional project. And we have provided a link in the chat box, so feel free to have a little look at that. And Emma from Wales has asked, will the university provide my certificate, and is learner mentioned, or is it the university on the certificate? And I can see that we have replied to this. I'm just scrolling to find the answer. Yes, so your official document will be distributed by your university. It will not mention learner or that your course is online. Another question has just come in. How many hours a week will I be spending on the course? I'm not sure which course she's talking about in specifically.
I could talk as a general rule that usually we say little and often is the way forward with our courses. So logging in on a regular basis, an hour or two a day, up to around 20 hours a week is what we'd recommend. So yeah, I think it's no small undertaking doing a postgraduate programme. So it will take dedication and it will take time. But as we've mentioned a few times previously, the way that our courses are structured means that you can do this around your other commitments. So all you need is a tablet, a laptop, and an internet connection. And whether you're on your lunch break or you've got an hour in the evening, you can log on, you can look at the academic forum, you can engage, you can do some reflective practice. So really, it is a big commitment, but we try and make it as easy as possible, especially for healthcare professionals who we know are juggling usually a fairly hefty workload and other commitments, family, caring commitments, and things like that. But yeah, it's we'd say on average at least kind of an hour or so a day, maybe a little bit more on the weekends if you've got time, but you can do that wherever and whenever you want.
Thank you, Kirsty. Just to add to that, I can see that someone from our team has replied, and they said, due to the nature of the platform, you are able to do this within your own time, as Kirsty has just said. However, we advise 1 to 2 hours per day and over 4 hours over on the weekend. Is there any other questions that you may have for us today whilst we are
recognise the same as an on-campus qualification? I'm not sure what you mean by recognise there, Emma, but we always tell applicants to check in your region if you're international as to whether the course is recognised. It does vary from country to country depending on what the governing body decides. But Emma, you're in Wales, I can see, and in Wales 100% this is a postgraduate programme, the same as if you'd done an on-campus programme. It's completely the same, there's no difference. and it will be equally credited.
Thanks for addressing that question, Kirsty. I missed that, but please know that if we don't address all questions today, further up the chat, we will address them via email. But I'm just going to see if there's any more that come through. I'll just give a couple of minutes, seconds even.
If anyone does have questions that haven't been answered today, or they're thinking of applying and they get stuck with their application, or they've got any issues at all, you can email us at admissions@learner.ac.uk, and someone will get back to you as soon as they possibly can. And we can also schedule a call with you, whether it be on the phone or on Zoom, and really help you with your application. I can just see Linda's question in there. Thank you, Linda. Can you do the postgrad course, have a year off, then come back for the MSc? Absolutely. What we'd suggest is you would apply for the postgrad diploma, and then many of our students, once they get to the end of that, will then decide if they want to carry on for the second year and top up to the MSc. And there is no need to do that straight away. You can take that year, give yourself a break, and then come back and finish off with the MSc the year later. That's absolutely fine. Otherwise, you can sign up for the 2-year MSc and kind of do the whole thing straight through. It's really up to you.
Thank you, Kirsty. Is there any other questions? She's just said thank you. Linda said thank you. Is there any other questions today for us to address? I don't think there's any more questions. Just give it a couple of more seconds. Nope, I don't think there is any other questions. So a big thank you to all who have attended. Thank you very much. And thank you to Kirsty and Helen. I think it's been very informative today. And we hope that you found this event very beneficial. And if you would like to learn more, again, we'll be sending an email and we'll be linking this video. So you'll be able to watch this event again if you've forgotten some of the answers that we have given today. So yeah, we'll be able to answer any questions as well that we might have missed. I think we've covered everything in the chat box, but we'll definitely be able to address via email. So thank you all for attending again, and yes, bye.
Good luck with your applications, everyone.
Good luck. Bye.
Bye.